Okay, I'm gonna do some hand hygiene. Hi, my name is Cynthia. I'm gonna be your SRNA for the day. Can I get your name and date of birth?
Kayla, July 23rd, 1999.
Okay, Kayla, what brings you in today?
My annual physical.
Okay, patient appears to be awake, alert, and oriented. Attire and affect is appropriate. Patient knows why she's here. So I'm gonna go ahead and check her vitals now. I'm gonna check the radial pulse for 30 seconds and multiply by 2 while I check her respirations. Okay, pulse is 72, respirations were 16. I'm gonna go ahead and check her blood pressure now. So I'm gonna put the blood pressure cuff. And then blood pressure reads 118/68. So patient is normal tensive. Now I'm gonna go ahead and assess her head and neck. Everything appears to be symmetrical. There's no lesions, no bumps. Is it okay if I touch your scalp?
Mm-hmm.
Okay, on palpation, I don't feel any bumps or lesions. I'm gonna go ahead and assess your trachea. So just gonna grab your neck if that's okay.
Mm-hmm.
Okay, if you can please swallow. Okay, thyroid is movable, trachea is midline, seems appropriate. I'm gonna check your lymph nodes now. I'm gonna go ahead and assess your pre-auricular, post-auricular, tonsillar, submandibular, submental, superficial cervical, posterior cervical, and supraclavicular. There didn't appear to be any swelling, no edema of the lymphs, no redness, no tenderness, so findings are appropriate. So I'm going to go ahead and check your cranial nerves now. We're going to start with your eyes. I'm going to go ahead and check your pupils. Okay, pupils are equal, round, and reactive to light. If you can look at the tip of my pen without moving your head. Okay, there seems to be no nystagmus. Movements seem appropriate. Cranial nerves 3, 4, and 6 appear to be intact. I'm going to go ahead and check your cranial nerve 2. So if you could stand up and cover your right eye. Can you read me the lowest line that you can read?
A, B, C, D, E.
Okay, can you cover your left eye now and read the lowest line backwards?
E, D, C, B, A.
Okay, great. You can take a seat now. Patient appears to have 20/20 vision. Cranial nerve 2 appears to be intact. We're going to go ahead and assess her nose right now. You can look up. Okay, I don't see any drainage. Nose appears symmetrical, no lesions. We're going to test your smell. So if you can smell and tell me what you smell.
Peppermint.
Peppermint. Okay, cranial nerve 1 appears to be intact. Now we're going to check 5 and 7. So I'm going to have you raise your eyebrows for me. Good. Smile. Puff your cheeks. Okay, if you can close your eyes for me and tell me what part of your face I'm touching you with the pen.
Forehead. Left cheek. Right cheek. Chin.
Okay, cranial nerves 5 and 7 appear to be intact. I'm going to have you stick your tongue out for me. Say ah. Great. Tonsils don't seem to be swollen. There's not any redness. Everything appears to be appropriate. Tongue appears appropriate with no lesions. If you can stick your tongue out to the left, to the right. Okay, so cranial nerves 9 and 12 appear to be intact. I'm going to go ahead and assess cranial nerve 8, your hearing test. But before I do that, let me inspect the ears. They seem symmetrical, no lesions. They look appropriate. There's no oozing. So I'm going to perform a whisper test. If you can cover your left ear, please, and repeat the words that I'm whispering.
Pink, blue, green.
Okay, if you can cover your right ear.
Flowers, cookies.
Okay, great. Cranial nerve 8 appears to be intact. Gonna go ahead and check cranial nerve 11 now. If you can push up against my arms. Okay, good. So now I have asked the patient to remove their shirt, and I'm gonna do my pulmonary assessment. Upon inspection, Breathing appears to be appropriate. There's no use of accessory muscles, no nasal flaring, no apparent shortness of breath. So I'm going to go ahead and palpate your anterior chest now. I don't feel any lumps. There are no lesions. If you could turn around for me. Thank you. So I'm going to go ahead and percuss your lung fields. So I'm hearing resonance throughout. Now I'm going to go ahead and auscultate. You can take a deep breath for me. So I'm hearing vesicular sounds throughout. No crackles. No wheezing. If you could go ahead and raise your right arm for me and auscultate your right middle lobe. Okay, I'm going to go ahead and percuss. Okay, you can put your arm down. If you could turn around for me again. I'm going to auscultate your anterior chest now. Take a deep breath. Okay, vesicular sounds throughout. I'm going to listen over your trachea. Okay, we hear bronchial sounds, which is expected. I'm going to go ahead and use my bell to listen to your thyroid for any bruise. Okay, so patient's pulmonary function appears to be appropriate. I'm going to do the cardiac assessment now. I've asked the patient to lay down at a 30-degree angle, and I'm on their right side. So upon inspection, inspecting the pericardium, everything seems appropriate. There doesn't seem to be any, I'm going to palpate if that's okay. There doesn't appear to be any protrusions, no lesions. So I'm going to go ahead and listen to heart sounds. Slap my face over here. So with my diaphragm, I'm listening in my aortic area, pulmonic, Erb's point, mitral, tricuspid, and then mitral. This is also the point of maximum impulse, the apical pulse at the mitral. Now I'm going to listen with my bell for any bruise. Okay, so upon auscultation, heart sounds were appropriate. I heard S1, S2. There were no S3 or 4, no splitting. With my bell, I didn't hear any murmurs or bruise. So I'm going to go ahead and auscultate your carotid artery right now with my bell to see if I hear any bruise. No bruise in the carotid artery. I'm going to palpate the pulse of the carotid arteries. Pulses are good, +2. I'm going to assess for any jugular vein distension, which there doesn't appear to be any jugular vein distension. So I'm going to go ahead and assess your radial pulses. Pulses are +2. And check your femoral pulses. And check your popliteal pulses. Post-tibial pulses. Dorsalis pulses. While I'm here, I'm going to check cap refill. Cap refill is immediate. There doesn't appear to be any swelling or redness, no edema of the lower extremities. I'm going to go ahead and assess cap refill of the upper extremities. Also immediate. And actually going to go ahead and auscultate your aorta with my bell to see if I hear any bruise. Okay. Everything seems appropriate. We're going to move on to the abdominal portion. Upon inspection, the abdomen appears to be appropriate. I don't see any scarring, no lesions, no protrusions. I'm gonna go ahead and auscultate all 4 quadrants. Okay, bowel sounds appear to be normal active. Patient has bowel sounds in all 4 quadrants. I'm gonna go ahead and percuss now. Let me know if you feel any pain. Okay, upon percussion, I hear a lot of tympany, which is expected. If you can raise your left arm for me, thank you. I'm gonna percuss the spleen. Still hear tympany, which is expected. Trying to palpate the spleen. I can palpate. There does not appear to be any spleen enlargement. You can lower your handle, thank you. Upon inspection, I cannot identify the liver span, but diameter should be between 6 to 12 centimeters. I'm going to move on to palpation now. So I'm going to do light palpation and let me know if you feel any pain. Okay, now deep palpation. Okay, on palpation, there didn't appear to be any hernias or bulges under. Everything appeared appropriate. So I'm going to palpate the aorta now. Okay, I cannot feel the aorta, which is normal and expected finding. We're going to move on to range of motion now. Since patient is already laying down, I'm going to go ahead and check hips. Let me know if you feel any pain. Okay, I'm going to check your knee. Okay, check your other leg. Check your knee. Okay, hip and knee joints appear to be appropriate. There's no crepitus, no redness, no pain. So now I'm going to assess the patient's joints and range of motion. If you could push against my hand. Good. She gets my hand. She gets my hand. Great. You can take your arms out. We can check your shoulders and do circles. Good. Can you put your arms out in front of me? We're going to check your wrists. If you can flex and extend. Good. You squeeze my hands. Good. Good strength. Hands appear appropriate. Now if you could bend your elbows for me. Push up against me. Pull against me. Good. I'm going to go ahead and check your ankles now. So if you could push up against my hand, push up against my hand. Good. While I'm here, I'm going to check your Babinski reflex. So patient's response was appropriate. Toes did not open up. They curled in. Now we're going to go ahead and check your reflexes. If you can sit back for me so your feet are hanging, thank you. So I'm going to check your Achilles reflex behind your ankle. Good. I'm going to check the patellar reflex and below the knee. Good. I'm going to check your brachioradial reflex. I'm going to check your bicep and your tricep. And let's do the other side. Brachioradius. Bicep, and then tricep. Good. I'm going to go ahead and check your coordination. So I'm going to have you touch the tip of my finger with your finger and then your nose. Good. Other hand. Good. Now if you can take the heel of your left foot and push down from your knee down your shin. Good. If you can do the next leg. Good. Response is appropriate. Patient has good coordination. I'm going to have you stand up for me. I'm going to assess your gait. So if you could walk. Good. If you can walk back now, toe to heel. Patient has good gait and good balance. I'm going to have you stand facing me with your feet together. Close your eyes. We're going to do the Romberg test. So we're going to check for 30 seconds. Patient isn't swaying or losing balance. Response is appropriate. Good. Okay, you can sit. Patient patient passed their physical with flying colors. This patient appears to be very healthy. Go ahead and do hand hygiene before I leave the room. Good job. Yay.